Health stakeholders have been urged to consider harm reduction as a key guide in driving public health strategies in Africa. Harm reduction is an intervention aimed at reducing the negative effects of health behaviors such as smoking without necessarily putting out such problematic health behaviors permanently. Harm reduction advocate Tobacco Harm Reduction Malawi, Chimwemwe Ngoma, said this during his presentation at the 3rd Harm Reduction Exchange meeting in Nairobi, Kenya. Kondwani Jinere has compiled this report, which is being read by Blessings Cheleuga.
Ngoma told the meeting that African countries need to put in much effort in disseminating information and adopting the tobacco harm reduction concept in order to save lives of people who smoke combustible cigarettes. He said although countries including Malawi have made great strides in other public health areas including HIV prevention, the tobacco harm reduction is a new concept to African countries including Malawi.
Malawi has done a lot in terms of harm reduction in general. We talk about HIV and AIDS. We have made tremendous improvements or achievements. We have tapped the milestones in harm reduction when it comes to HIV and AIDS. So in the other harm reduction world, I think as a country, Malawi, we have done enough. But when you talk about tobacco harm reduction, we haven't really done much, and there are no existing structures. And I'm sure and I'm hoping that the Malawi government will take this up very soon and will implement harm reduction because it has a track record of bringing positive change to public health.
Ngoma recommends that Malawi needs to take up tobacco harm reduction approach in order to save lives of people that are addicted to nicotine through smoking combustive cigarettes.
As a country, Malawi, there are several things that we can do in order to promote the adoption of harm reduction tools. One of it is by making the harm reduction tools themselves available on the market. For example, if we say harm reduction in HIV and AIDS and we don't have condoms available, which is a harm reduction tool, that means we're not doing much. In tobacco harm reduction, when we talk of electronic cigarettes, snus, nicotine pouches as harm reduction tools and they are not available, that means we are just having a discussion without really making the products available.
On her part, Integra Africa founder and inspirer Dr. Tendai Mhizia emphasized that journalists and media houses have a crucial role to play in handling misinformation and disinformation in tobacco harm reduction discussions.
The media is our fourth estate, and the media are the ones who can only get this message out there to let the citizenry know that they have alternatives, safer alternatives to products and services that they would use which would otherwise be seen as harmful. There are ways to reduce harm through using other products for those who cannot, of course, do first prize, which is to quit these harmful behaviors.
Mhizia said tobacco harm reduction has the potential to bring about great public health achievements, so raising awareness for tobacco harm reduction as a public health strategy encourages adult smokers who are unable or uninterested to quit tobacco altogether to migrate to non-combustible product alternatives. Health statistics show that close to 1 million people are active daily tobacco users in Malawi, and approximately 5,700 people in the country die from tobacco-related illnesses annually. The theme for the 3rd annual Harm Reduction Exchange was amplifying the voice of harm reduction advocacy across Africa.
You're watching MBC News and you're with me, Evelyn Chingambe. A reminder of our top stories. President Chakwera calls for teamwork for the country to achieve meaningful development. People from 9 villages under traditional authority Mlolo in Sanje from Mankanga area, which is among the dangerous flood-prone areas in the country. And Neno District Council steps up efforts to eradicate rabies in the district.